Welcome to the Salmon Runs YouTube. Enjoy the video.
You begin by establishing a clear baseline. Go straight to a comprehensive eye exam so you know current acuity and prescription. Once done, optimize your environment. Increase contrast, reduce glare, and set your monitor at eye level. Make the 20-20-20 rule automatic. Every 20 minutes look at something 20 feet away for 20 seconds to reduce accommodative strain. Also, intentionally blink more and use lubricating drops if dry. These small changes lower strain and let corrective routines work. Now you move into targeted routines that retrain accommodation and eye teaming. Start with 10 to 15 minutes of near-to-far focus shifts. Hold a pencil at arm's length and slowly bring it in while keeping it single. Next, add convergence and tracking drills, move a target in an S shape and follow smoothly. Increase difficulty each week. Support neural health with consistent nutrition, omega-3s, lutein, zeaxanthin, hydrate well, and get 7 to 8 hours of sleep so visual learning consolidates. To finish, make monitoring your habit. Log acuity changes, note symptoms, and record exercise compliance so you can objectively adjust intensity. If progress stalls, upgrade optical correction or try orthocratology contacts and consult a vision therapist for personalized protocols. Keep expectations realistic. Improvement can be gradual. If at any point you experience worsening vision, persistent pain, flashes, or new field loss, stop the program and see an eye doctor right away. That single troubleshooting step protects your sight.
Thanks for watching. Consider subscribing if we helped you.